You ever get that feeling? You know, when something complex, like a big machine or maybe even, a living system, it just feels a little off?
Mhm.
And then you dig in and you realize just how incredibly intricate it all is, how many things have to work just right.
Absolutely, that hidden complexity.
Well, today we're looking at something that might sound a bit niche, but it really shines a light on that exact idea: bovine cecal disorders.
Right.
We're talking about things like cecal dilatation, volvulus, and impaction in cattle. These might sound obscure, but they're incredibly impactful for the animals, for productivity, and yeah, surprisingly complex.
They really are.
So our mission today, our deep dive, is to unpack these conditions. They're distinct, sure, but also really interconnected. We're drawing on some comprehensive vet reviews here,
Good sources.
and we want to see how understanding these gut issues, these seemingly local problems, actually gives us some profound insights into, well, the whole animal's physiology, that delicate balance needed for health.
And these disorders, they are truly significant, especially, in high-producing dairy cattle. We see them pop up a lot around calving time, that periparturient period.
Ah, stressful time for the cow.
Hugely stressful.
Yeah.
Massive metabolic shifts happening. And the tricky part is the early signs, they can be really nonspecific, vague.
Hard to pin down.
Exactly. Which makes diagnosis a real challenge for vets. Getting it right and getting it early is just absolutely critical for a good outcome.
Okay, let's unpack this then before we get into the specific disorders, maybe step back a bit. What exactly is the bovine cecum? And I guess, why is it so prone to problems?
Right. So the cecum, it's essentially a blind-ended sac. Think of it like a pouch. It's the very first part of the large intestine in cattle.
Okay.
And along with the ascending colon, its job is really important post-ruminal fermentation, absorbing nutrients after stuff leaves the rumen.
So still digesting things.
Absolutely. But the key thing, anatomically speaking, the thing that really sets the stage for these issues is how it's suspended in the abdomen. It's relatively loose.
Not tightly fixed in place.
Not really, no. It has a bit more freedom to move compared to other parts. And that inherent looseness, that anatomical feature, well, that's what predisposes it to motility problems, getting displaced, even twisting on itself. It's fundamental to why these conditions happen.
Got it. So that anatomy is sort of the starting point for trouble. Okay, let's start with cecal dilatation then. The reviews call this the mildest of the three. What does it actually mean for the cecum to be dilated?
Yeah, mildest is relative, but compared to the others, yes. Dilatation basically means there's a mild buildup of gas or digesta or maybe both. And this causes the cecum to stretch, to distend.
Like a balloon inflating slightly?
Kind of, yeah. And it often expands back towards the pelvis, into the pelvic inlet. The apex, the tip of the thack, usually points backward, caudally. But the crucial point here is that the passage of digesta, food moving through, it's generally not blocked.
Okay, so it's swollen, but stuff can still get through, more or less.
Right. It's more about distension than a complete stop.
That's interesting, that it can swell up without a full blockage. So what's going on behind the scenes? What actually causes this slowdown, this distension?
Well, it's usually not just one single thing, but it mostly boils down to disturbances in gut motility, how the intestines are moving.
Right.
High concentrate diets are a big one. You feed a lot of grain.
Yeah.
You get excessive volatile fatty acid production, BFAs, in the cecum and colon.
Right.
And that drops the pH, makes things more acidic, which then slows down motility. So this hypomotility, this reduced movement in the cecum and colon, that's really a central feature.
Makes sense.
We also know hypocalcemia, milk fever, especially right after calving. That can cause a general gut stasis, slowing everything down and contributing to this distension.
Okay, so dietary factors, metabolic issues like milk fever. What would you actually see in a cow with cecal dilatation? What are the signs?
Typically, you'd notice she's off her feed, maybe just picking, that's hyperexia. Milk production will likely drop, and a key physical sign is you might see or feel some distension in the right flank area, the right paralumbar fossa, usually mild to moderate.
That triangle area behind the ribs.
Exactly. You might also notice her manure is scant, or maybe the consistency is variable. Mild colic, some signs of belly discomfort, that's common too. But usually her vital signs, heart rate, temperature, and her rumen function, they stay pretty much normal.
Okay.
Oh, and one other thing, it's very common for ketosis to go along with it.
Yeah.
Because she's not eating properly, she goes into negative energy balance.
Right. That makes sense. So how do vets nail the diagnosis, and what's the usual treatment path?
Diagnosis relies a lot on a rectal exam. You can actually feel the gas distended cecum. It's usually pretty movable back in the caudal abdomen, often filling up that pelvic inlet area.
You can feel it's bloated.
Yeah. And another classic diagnostic sign is the ping. You flick the flank while listening with a stethoscope over that right paralumbar fossa, and you hear this tympanitic drum-like sound.
Like tapping a top balloon.
Exactly. Ultrasound can be helpful, too, to visualize the distended cecum. As for treatment, you generally start with medical management first.
Okay.
That means correcting any electrolyte imbalances, treating the ketosis if it's there, adjusting the diet, usually backing off the concentrates, increasing forage, and sometimes encouraging a bit of exercise can help stimulate motility.
And if that doesn't work?
Then you might consider surgery, a procedure called a typhlotomy that's basically making an incision into the cecum to empty it. That's usually reserved for cases that just aren't responding to medical treatment, or if it's become a chronic issue.
And sometimes removal.
In really severe cases, yeah. If there's tissue death, necrosis, or just severe distension that won't resolve, then a partial typhlectomy removing part of the cecum might be the only option. But that's less common for simple dilatation.
And the prognosis. What are the chances for these cows?
Generally, it's very good. With the right treatment, given promptly, most cows recover completely. They usually get back to full milk production.
So even though it's the mildest, dilatation sounds like it's still a really important warning sign, doesn't it? Like a signal that something in the cow system, maybe diet, maybe metabolism, is off kilter.
That's a great way to put it. Yeah, a canary in the coal mine, perhaps.
Yeah.
It's not immediately life-threatening like volvulus, but it absolutely signals an underlying issue with gut function or metabolism that needs attention. It's often, the body's first sort of whisper before it starts to shout.
Okay, now let's get to the shouting. Cecal volvulus. This sounds like a whole different level of urgency. How is it fundamentally different from just dilatation?
Oh, completely different. Night and day, really. Cecal volvulus is an acute, life-threatening emergency. Full stop.
Right.
What happens here is the cecum, and usually the first couple segments of the proximal colon attached to it, they physically twist around their mesenteric axis. That's the tissue that holds them and supplies blood.
A literal twist in the gut.
Exactly. And this twist leads to incarceration. The bowel gets trapped, and often strangulation, obstruction. That's the critical part. The blood supply gets cut off. Ischemia.
Okay, strangulation.
Yeah, and this causes a partial or complete blockage of the lumen, the inside of the intestine. And without blood flow, that tissue starts to die fast.
Wow. Okay, so beyond just the blockage, that strangulation, obstruction, break that down a bit more. What's happening inside the cow systemically that makes it life-threatening so quickly?
Right. It's not just about stopping the flow of digesta. The major immediate danger is the vascular compromise, the lack of blood flow. This leads really rapidly to hypoxia in the intestinal lining.
Not enough oxygen.
Correct, which kicks off inflammation and then quickly progresses to necrosis tissue death in the intestinal walls. Often the damage is worst right at the junction between the first and second bits of the proximal colon, not always just the cecum itself.
So the tissue is dying.
And systemically. The cow dehydrates incredibly fast. Fluid shifts out of the bloodstream. You get hemoconcentration, hyperproteinemia. But the really key thing, the hallmark systemic problem that develops early and fast, is a profound metabolic derangement. Hypokalemic metabolic alkalosis.
Whoa, okay. Low chloride, low potassium, and alkalosis.
Exactly. Their whole body chemistry goes way out of whack.
Yeah.
And that affects everything. Muscle function, nerve function, heart rhythm. It's a major systemic crisis triggered by that twist.
So given that severity, what are the clinical signs that scream surgical emergency? What raises those immediate red flags?
It's usually an acute onset. The cow deteriorates rapidly. Anorexia, not eating at all, and a really sharp drop in milk production, much more severe than with dilatation.
Right.
You'll see severe distension of that right paralumbar fossa. But the absolute key sign is persistent, moderate to severe colic, real abdominal pain. She'll be uncomfortable, maybe kicking at her belly, getting up and down.
Obvious pain.
Yes. And fecal output usually just stops completely, scant or absent. The rectum might feel dry, sticky on exam. You'll likely see tachycardia, really fast heart rate, and tachypnea, rapid breathing because of the pain and dehydration. And if she starts going into shock, well, that's a very bad sign. This isn't something you watch and wait on.
Absolutely not. So with that urgency, how do vets quickly confirm it's volvulus, and what's the immediate game plan?
Diagnosis needs to be fast. Again, rectal palpation is crucial. You'll feel that twisted, very tense, distended cecum, and often the proximal colon. It feels different from dilatation, much tighter, often displaced further forward.
Distinctly different feel.
Definitely. And that ping sound, it'll be there, usually very loud, very tympanitic, and typically it extends further cranially, further forward than with dilatation,
Mm.
often up to the 10th, 11th, 12th rib area. Lab work helps confirm too. You'll often see leukocytosis, high white blood cell count, indicating inflammation or infection, and those classic electrolyte changes, low chloride, low potassium, metabolic alkalosis, and treatment. There's really only one answer: immediate surgery. That is the primary and usually the only effective approach.
No messing around.
None.
Yeah.
You need to stabilize her first, of course, especially if she's badly dehydrated. Aggressive 5E fluids are essential broad-spectrum antibiotics too, because of the risk of bacteria leaking from the damaged gut.
Right.
Then in surgery, the surgeon has to carefully decompress the gas and fluid from the distended bowel before trying to untwist it.
Right.
Once it's repositioned, they have to assess the viability of the tissue. If there's necrosis, dead bowel.
It has to come out.
It has to be resected, yeah. The damaged section removed and the healthy ends joined back together.
Aha.
Sometimes, like in human medicine where they do a colopexy to tack the colon down, similar techniques might be considered in cattle to try and prevent it happening again, but the primary goal is untwist and restore blood flow, or resect if needed.
So what does this all mean for her chances? Survival rates?
It really depends on timing. If you get to surgery early while the bowel is still viable, the prognosis is actually very good. Most cows can recover fully.
That's encouraging.
But if treatment is delayed, the prognosis becomes grave very quickly. Some studies show mortality rates over 30% if surgery is delayed beyond, say, 24 to 72 hours. That window for successful intervention is narrow, really narrow.
Wow. That really drives home how a localized twist can just explode into a systemic crisis. It proves that in these complex systems, like a cow's body, there really aren't any truly isolated problems, are there? The clock is just ticking so fast, and the whole body ends up paying the price.
That's exactly right. It's a powerful illustration of that interconnectedness.
Okay, let's shift gears to the third condition, cecal impaction. This one sounds different again, more like a blockage, a physical obstruction, rather than a twist or just gas, almost like a traffic jam in the gut.
That's a pretty good analogy, yeah. Cecal impaction is exactly that, an accumulation of a dense, often indigestible food mass within the cecum itself, and this mass physically obstructs the lumen, blocking the passage.
Okay.
A lot of the detailed research on impactions actually comes from horses, where it's a common colic cause. But the basic principles, the obstruction, how you approach treatment, they apply similarly in cattle. It's analogous in some ways to bull muzzle impactions we see in cows too.
Right. So what kind of dietary factors or maybe management issues lead to these kinds of blockages? What causes this traffic jam?
It's usually multifactorial, several things contributing. Diet is often a primary player. Things like feeding too much roughage that's low quality, low in digestible protein and energy,
Huh?
especially if that's combined with reduced water intake.
Hmm.
Think cold weather, maybe frozen water troughs. That's a classic scenario.
Dehydration playing a role.
A huge role. Also, overfeeding highly fermentable carbs can sometimes reduce cecal contractility, slowing things down. Really coarse roughages, sudden big changes in diet, even cattle eating sand if they're fed on the ground in sandy areas, those are all risk factors.
So lots of potential triggers.
Definitely. And underlying issues too, pre-existing gut motility problems, maybe dental issues so they're not chewing properly.
Yeah.
But yeah, dehydration is often a critical predisposing factor. It leads to drier gut contents that are just harder to move along. It really shows how diet, water, environment, health, it's all linked.
So what would a farmer or vet typically see? How does impaction present itself?
The signs here are often more insidious. They tend to develop more slowly, more subtly than volvulus.
Less dramatic onset.
Generally, yes.
Yeah.
You'd usually see mild colic, but it might come on gradually. A really common sign, sometimes the only sign initially, is decreased manure production. Just not pooping as much, maybe none at all. And when they do pass feces, it might be dry, hard, maybe covered in mucus. Anorexia, being off feed, and some depression or lethargy are common too. Abdominal distension is usually less obvious than with dilatation or volvulus.
Right, because it's a solid mass, not mostly gas.
Exactly.
So how do you diagnose this one, and what are the treatment options for impaction?
Diagnosis starts with a good history, asking about feed, water access, any recent changes. Then the clinical signs. Again, rectal palpation is key.
What do you feel?
You typically feel a firm, kind of doughy mass in the cecum's location, usually to the right of the midline, often near the pelvic inlet. It feels distinctly different from a gas-filled structure. Ultrasound can be useful too. It might show what's called a mixed echoism pattern inside the cecum. reflecting that dense, varied texture of the impacted material. Lab tests. They might show that metabolic alkalosis, low chloride, low potassium pattern again, especially if you think about the similarities to abomasal impaction, where that's common due to outflow obstruction effects. Treatment focuses on softening that impaction, trying to get the gut moving again. So medical management is the first step.
Like what?
Lots of fluid therapy, often both IV and oral fluids if she'll drink. Laxatives are important, things like mineral oil given by stomach tube or maybe DSS, dioctyl sodium sulfosuccinate. Some dyprokinetics, drugs to stimulate gut motility, might be tried.
And if medical treatment isn't enough?
Then, similar to severe dilatation, surgery might be needed. A typhlotomy to physically remove the impacted mass. That's generally for the severe cases that just aren't responding.
And the outlook for recovery with impaction?
Generally, it's favorable, especially if it's diagnosed and treated early. But severe, long-standing impactions, those carry a much higher risk. They can be tough cases. And recurrence is definitely possible if those underlying dietary or management problems aren't fixed. It's another reminder you have to look beyond just clearing the blockage. You need to fix the cause.
Okay, so that brings up a really important point. We've talked about these three conditions, dilatation, volvulus, impaction, mostly focused on the gut itself. But clearly they don't just stay there, do they? How do these Cecal disorders impact the entire animal? And, maybe most importantly, what can be done to prevent them in the first place?
That's absolutely the crucial connection to make. These disorders, especially the more severe ones like volvulus and significant impaction, they definitely trigger a cascade of systemic problems.
Right.
We've already touched on the big one with volvulus, that hypochloremic, hypokalemic, metabolic alkalosis. It's worth stressing again, this isn't just a simple consequence of blockage. It's a profound systemic imbalance. Part of the thinking is that the massively distended cecum and colon can actually compress the duodenum, impairing outflow from the stomach and contributing to these deep metabolic shifts that throw the whole body off.
Affects everything.
Pretty much. And those electrolyte imbalances, particularly the low potassium, hypokalemia, and the alkalosis, they can directly lead to heart problems, specifically atrial fibrillation, or AFib.
The most common heart rhythm issue in cattle.
That's the one. Low potassium and alkalosis really set the stage for it. If you looked at an ECG, an electrocardiogram, you wouldn't see the normal P waves that signal the atria contracting properly. Instead, you'd see these chaotic fibrillatory waves, and the main heartbeats, the RR intervals, would be irregularly irregular.
You can hear that irregularity.
Oh yeah, listening to the heart auscultation, you'd hear that classic irregular rhythm. It's quite distinct.
Wow. What else systemically?
Well, peritonitis is a major risk. Inflammation of the abdominal lining. That happens if the bowel wall gets so damaged, especially in volvulus, that it perforates or leaks bacteria. That's really serious.
Yeah.
And as we mentioned, ketosis and negative energy balance often go hand in hand with dilatation and impaction simply because the cow isn't eating enough. Then there's the whole pain and stress aspect.
Right, can't forget that.
It significantly impacts their welfare, obviously, but also production and even immune function. Stress hormones can suppress the immune system. We even see things like an excitable temperament due to chronic stress or discomfort, potentially affecting weight gain or making them more prone to other diseases. It's all connected. So that leads directly into prevention. And it really has to be a multi-pronged, holistic approach. You can't just focus on one thing.
Makes sense. What are the key areas?
Dietary management is absolutely fundamental. Optimizing that roughage to concentrate ratio is key. Using good quality feedstuffs, avoiding sudden, drastic diet changes, and ensuring adequate water intake. That's huge, especially for preventing impaction.
Water, right. Seems simple but critical.
It really is. Then, that periparturient period, around calving, that needs special attention. Monitoring cows closely for signs of milk fever, hypocalcemia, and treating it promptly. Preventing ketosis through good transition cow management.
Targeting that high-risk window.
Exactly. Early detection and prompt intervention for any signs of trouble are also vital. That means having staff trained to spot subtle signs, monitoring cows aggressively, especially during risk periods, and getting veterinary help quickly when needed.
Don't wait and see.
Definitely not with these conditions. And lastly, something maybe less obvious but still important, handling and stress reduction. Using low-stress stockmanship techniques, trying to habituate animals to handling, making sure their environment is comfortable, it all helps reduce physiological stress, which can indirectly benefit gut function and overall health. It really is about looking at the whole cow, her whole environment, not just one part of her gut.
This has been incredibly insightful, a real deep dive. We've seen how these Cecal disorders, while distinct, are just so profoundly linked by these underlying factors, especially gut motility. And it really hammers home the importance of catching things early, getting that diagnosis right.
Indeed. And I think the key takeaway is that managing these successfully demands that comprehensive view. You're not just treating the twisted gut or the blockage. You have to manage the metabolic fallout, the potential heart issues, the inflammation, all while putting robust preventive strategies in place that consider everything from feed to stress. It's a delicate balance, truly.
It really is. Like thinking about these huge impacts on cattle, how something seemingly small, like a diet shift or a bit of stress, can snowball into these critical body-wide problems. It really makes you wonder, doesn't it, about all the intricate, interconnected balances at play in any complex biological system. What other, blind-ended sacks or delicate points of failure might we be overlooking, maybe in our own lives or in totally different fields, where a small imbalance could have these massive cascading effects? Something to think about.